Ozzy Jurek has just emailed me. He knows I'm doing my shocking stat right now. He says he's got one that will top whatever I'm doing because he doesn't know what I'm about to do. He says he's got one that will top mine. I'm looking forward to getting that from Ozzy. For this week's shocking stat, you can pick which one is the most shocking among these choices. 20 weeks, 47 weeks, 11th, or 160 billion. Let me elaborate. 20 weeks is the Canadian average wait time to see a medical specialist like a general surgeon or ophthalmologist, gynecologist, neurosurgeon, according to the most recent medical wait time survey conducted by the Fraser Institute for the year 2016. And speaking of neurosurgeons, 47 is the average number of weeks you wait to see one, the longest of any wait time to see a specialist. The average wait time of 20 weeks, think about this, compares to 9.3 weeks to see a specialist in 1993 when they first started to compile those wait list average statistics. 160 billion is the estimated government spending on healthcare. Now, individuals add on to that by spending 68 billion out of pocket on treatments that governments don't cover. It might be prescription drugs in most parts of the country. It could be anything. A lot of practitioners, whether it's an ophthalmologist, whether you're going to a dentist, a chiropractor, a lot of that is not covered unless you're part of a special medical plan in the public sector or the private sector corporations. But that's 160 billion is the estimated government spending. Now that's up from around 55 billion they spent in 1993. Now the population has grown from 28.7 million in 1993 to 35.1 million, so that partially explains the extra money. But we've gone from 55 billion to 160 billion in government spending, but our wait times have gone from 9.3 weeks to 20 weeks on average. It's incredible. We also, in that period, just had a huge bump up in money thrown at the problem, specifically at wait times in the 10-year period up to 2011. But the point is, we've basically had no progress. 11th, well, that refers to our ranking of 11 Western countries in terms of waiting to see a specialist, new data out of the Canadian Institute of Health Information. In 2014, the latest they did, the U.S.-based Commonwealth Fund ranked Canada second to last on a comparative scorecard of 11 healthcare systems in terms of getting value for money. Actually better than when we compared with the European nations where we came in dead last for value for money. So think about those stats. Your choice. 20 weeks, length of time to see average wait time for a specialist. 47 weeks for a neurosurgeon. 11th, that's where we just ranked by the Canadian Institute of Health Information when it comes to waiting to see a specialist. That was out of 11 countries. And 160 billion, that's how much we spent basically last year on public sector health spending. So to all those who continue to shout our healthcare is number one, you're absolutely right, if you're talking about how long I have to wait to see a specialist. That's this week's shocking stat.